Did you have a trauma in the past, whether it's a sports injury or a car accident? Ever since, right here on one side of the back of the head, one side or the other, you feel like a muscle is just locked down. You feel foggy in the head. You feel like your spinal cord's being choked off, and you got this constant pressure and pain right at the back of the head that doesn't go away. And if it does go away, it's only temporary from some medication that you're taking. You want to know what actually happened. So your head weighs 10 to 12 pounds. This is the atlas, right where the top, or where the head fits. It fits on the top vertebra that weighs 2 ounces. When you have a whiplash type car accident or blunt trauma, that can cause this 2-ounce bone to shift and lock under the skull. And the reason that's important is there's a structure down through the atlas, which is called the brain stem, and overlying the brain stem, there's a sock-like sheath. It's called the dura mater. So there's a structure or a physiological connection they just discovered not too long ago called the myodural bridge. Myo stands for muscle. Dural is the dura mater, that sock-like covering over the cord. The atlas has many muscles that attach to it and also attach to the back part of the head in C2 called the suboccipital muscles. And one of those group of muscles, underneath its surface, there's a connective tissue that connects to the sheath that covers the cord. That's why it's called myo, the muscle, dural, bridge. That connective tissue is the bridge between the muscle and the cord. And what can happen is when that atlas dislodges, those suboccipital muscles get tight, usually more on one side than the other. That's where that jammed feeling, that searing pain and pressure you feel. And when that muscle contracts, that connective tissue is pulling on the dura mater of the cord, and it can irritate the cord and cause all sorts of cascade of neurophysiological issues through your body. Not just that pain, cognitive problems, low energy, sleep trouble, TMJ problems, sinus trouble. It can all be related, trigeminal neuralgia. And so if you're dealing with these types of problems, we are located in Sarasota, Florida. We run an upper cervical chiropractic office. We take 3D imaging of the neck to look at these two joints to see exactly in millimeters how that vertebra is dislodged out of place. And then we make a very precise correction. There's no twisting, popping, or pulling. The end goal is to get that segment back in its normal range of motion, get it to stay there as long as possible so it can heal up, so the suboccipital muscles will return to their normal tone. And at the other end of that is better physiology, better health, better function, happier you. If you're in the Sarasota, Florida area, we offer a free consultation. If you're outside the Sarasota, Florida area, you can leave a comment in the comment sections below. Where you're at, we'll find you a doctor. If you want to go to a website that houses doctors throughout the country that do this, actually world, that do this work, go to www.uccnearme.com.